Hello everyone, welcome to sqadia.com, and our today's topic of obstetric lecture is Antepartum Complications, and my name is Saima Mushtaq. We divided our lecture into 5 sections. In the first section, we will talk about the post-term pregnancy and ABO incompatibility. Very common complications of pregnancy, post-term pregnancy and ABO incompatibility. And in this, we will mainly talk about the post-term pregnancy, and later on in the next sections, we will also talk about in detail ABO incompatibility. So in this section, we will talk about what are the causes, risk factors, and management mainly of the post-term pregnancy. And then in the next section, second section, we will talk about the vaginal bleeding. What are the causes of vaginal bleeding during pregnancy? How we can take the history of the patient with the vaginal bleeding and how we examine the patient. And then we will also talk about the investigations and management of the vaginal bleeding, also known as antepartum hemorrhage, and how we can investigate and manage it. Then in the third section, we will talk about the rhesus disease and what are the causes of rhesus disease, what is rhesus isoimmunization, and what's the hemolytic disease of fetus and newborn baby. Then in the fourth section, we will talk about the sensitizing events in rhesus disease and what's the prevalence and prevention of rhesus disease. What are the potential sensitizing events and what's an anti-D immunoglobulins and when they are used. Then in the fifth and final section, we will talk about management of sensitizing events, in which we will talk about what are the signs of fetal anemia. Fetal anemia occurs as a result of rhesus disease, and then we will talk about what is the rhesus disease in sensitized women, and how we can treat and manage, and what is fetal blood transfusion, and what are some new developments in this regard. So all this will be covered in our today's lecture topic, Antepartum Complications. So to learn more about this lecture topic, keep watching sqadia.com.